Hey everybody, today we're going over blood flow restriction therapy, and its like different uses and how it affects different parts of the body. Blood flow restriction is a training method that has gained like pretty good attention for its ability to promote like muscle growth and strength gains using lower loads, so you don't have to lift as much. Um, so like I'm gonna go kind of over how BFR impacts the muscular, the endocrine, and the neural system, and then I'm also gonna discuss like practical exercise recommendations for implementing it. Um, Alright, for the first section, the muscular system. Um, the BFR therapy includes muscle hypertrophy and strength adaptations, and like despite using way lower, uh, lighter loads than traditional resistance training, you can get a lot done. Um, so increased type 2 muscle fiber recruitment. So like when blood flow is restricted, the reduced oxygen supply forces the body to recruit more fast twitch. Um, and then that that's responsible for like explosive movements and hypertrophy. Uh, these fibers typically activate under like heavy loads, but with the restrictive flow, it allows you to engage those at a much lighter weight. Um, there's also cellular signal pathways. So the BFR triggers the molecular pathways of the muscle growth, including the mammalian target of rapamycin um, pathway. And then that this pathway regulates like the protein synthesis and it leads to increased muscle size. Also, the BFR enhances the release of the IGF-1 in the muscles, and that further promotes antibiotic activity and recovery. Also, the metabolic stress and muscle swelling. So the accumulation of like the metabolites, like lactate and hydrogen ions, create like an anabolic environment that stimulate muscle growth. And this stress combined with cell swelling activates growth-related like mechanisms within the muscle tissues as well. So for the second section, the endocrine system, BFR also has a like pretty good impact on the endocrine system by enhancing the release of key anabolic hormones that contribute to muscle growth and recovery. Um, Growth hormone release, like a lot of the studies show that the BFR training significantly increases growth hormone levels, sometimes even surpassing levels seen in traditional like resistance training. Um, these growth hormones like play a crucial role in protein synthesis and tissue repair, and then also fat metabolism. Um, also, they enhance the production of testosterone and insulin like growth factor 1. These hormones facilitate muscle protein synthesis and recovery, making the blood flow resistance an effective tool for athletes, rehabilitating patients, and aging population looking to preserve muscle mass. Actually, when I had knee surgery, they did a lot of blood flow resistance before and after my surgery to just allow my muscles to stay strong like while recovering without having to put heavy loads on my knee. Um, and it also reduces myosin activity. Like it's a protein that inhibits like muscle growth, and it lowers the myosin levels, contributing to a greater hypertrophy over time. For the third section, it also affects the neural system. Um, it improves motor unit recruitment and it the neuromuscular efficiency. Um, it's like enhanced like motor unit recruitment. Um, it forces the body to rely more on like your fast twitch fibers. The nervous system adapts by like increasing the motor unit activation. This like can greatly improve your strength and coordination, even like with sub maximal loads. You don't have to like overload it. It just allows you to get to where you do with heavy loads without having to put as much on it. And then like the neuromuscular efficiency, um, by like repeatedly activating the high threshold of the motor unit with lower training, the the blood flow restriction enhances the neuromuscular efficiency, making movement more effective and improving overall force production. And the potential benefits this has for injury rehabilitation. It allows for like strength gains at like way lighter loads, and it's an excellent tool for like individuals recovering from injuries who need to like limit joint stress or while still maintaining like some muscle mass. So for my exercise proposal, my one of the effective exercises for the BFR training is body weight or low load squats. Um, so like the target muscle would be the quadriceps, the hamstring, and the glutes. Squats engage multiple muscle groups, but making them ideal for maximizing the benefits of it. The restricted blood flow enhances the metabolic stress, leading to greater muscle activation. Why I pick squats is since the blood flow restriction allows for hypertrophy with light loads, a simple air squat or a squat with just 20 to 30% of one's like one rep max can yield like pretty good results. This makes it ideal for like athletes looking to reduce joint strain while still like getting that size. And it's also like you're able to do it more places. So like if um like not everyone has access to some of the tools that are used at rehab facilities and stuff. So working with the air squat, I mean, you could do it in your living room by yourself. So how I would implement it, you apply the blood flow resistance cuffs to the upper thighs with like moderate pressure, and then you perform 4 sets with 30, 15, 15, 15 of the reps, and then you use the controlled tempo to maximize the time under tension. And then the rest period should be too long. It should be about 30 seconds. So basically, blood flow restriction training enhances muscle hypertrophy, stimulates key anabolic hormones, and improves neuromuscular efficiency. Um, and this is all done with like way lighter loads than traditional resistance training, and it makes it a super good tool for athletes, rehabilitation, and individuals looking to like optimize their muscle growth, but in a way safer environment with a lot less risk. You don't have to be at a gym with having a spotter and all that stuff. Sometimes you can just get it done with the resistance.